Introducing the ChildFair State Inquiry. Meet Molly, who's going to tell you a bit more about the project.
ChildFair State Project is a group of 26 young people, and as you heard, aged various ages through from, I think, 15 was the youngest, through to 22. Many of us have lived through lots of experiences, and through our research have learned about many others' experiences all over England with the ChildFair State, and we did this through a series of research methods, including interviews and online surveys. Through this research, we've been aiming to find out young people's experiences with the welfare state, what people think does and doesn't work with it, and young people's views and recommendations for changes that they think could be made to better suit their needs with the ChildFair State.
You're probably wondering how this is relevant to the inquiry. Here's Lauren to explain why.
When we were about halfway through our research, the pandemic hit, which, through its universal nature and the pressure it placed on institutions, showed us what society truly needed to function effectively. And, with that, highlighted the importance of our research like nothing else. Times of crises like the one we are currently experiencing are also opportunities for great change. Out of the last universal crisis this country faced, World War II, came Beveridge's vision for the welfare state, the implementation of which, I would argue, was an event which truly modernised British society. It was also a giant step forward on our country's still incomplete path to becoming a meritocracy. We are once again at a crossroads where one of the routes offered is the opportunity to propel Britain towards a truly modern future, one where all of its citizens, regardless of wealth, income or background, are provided with the resources not only to survive but also to thrive. We believe the vision which has come out of our research project is something which can help Britain on this path towards becoming a society where poverty and inequality are a thing of the past.
Eager to find out more? Then let's begin. We present the findings of the ChildFair State Inquiry, which will then be followed by the start of an emerging vision. Let's start with some findings.
Across council housing, accommodation, shared housing, student accommodation, as well as the transitions that young people want to make from moving from their parents' house to their own accommodation because of issues like mental health, possible domestic violence, and also just developing a sense of independence. So I think not knowing how to do that and not understanding the bureaucracy and the processes is really important. That in itself creates that precariousness, and it doesn't prepare you for what's to come.
Young people are faced with a lack of power, control, and a fear of landlords. No sense of rights, entitlement, and they feel there is no state housing system in place. Housing should be more reliable, and then you should be able to make it on your own and feel like a home. As young people have this urge, like this common theme that was put across through our research was that young people want to feel independent. They don't want to feel like a burden on their family and their friends. They don't want to unnecessarily use the systems, even though there can be something put in place like a guilt.
I do believe that all the inequalities have been kind of brought to the surface. Like for the BME people, they're most likely to live in, they're most likely to be in poverty, and there's so many things like digital poverty that has affected a lot of people as well, and yeah, it's just being brought to the surface and it's going to affect their grades and stuff.
Skills. And the quote says, "When you have an understanding of how the world works and how society functions in general, you have more power to change it." And from the survey we found out that 66% of people felt their educational needs were met.
It was kind of like, well, do you feel part of your community or neighbourhood? Some people would say they feel part of it as in they have friends and they know their neighbours, but some people don't feel a part of it as they are not a part of the changes being made. So for example, I come from an area around Peckham, and I felt a part of the community Peckham, like social wise, but when it came to like I forgot what the word is, gentrification.
Yeah, gentrification. Yeah.
When they were doing that, like I didn't feel like I had a say in anything, so that's why that stood out to me.
through this pandemic, there's been like, oh, something like what will happen, like, so people haven't really been like there for people, but there has been, you know, like when people are more vulnerable who can't go out and stuff, like there's been some like neighbours have gone, oh, I'll go and get your shopping in for you and stuff like that, but some people haven't, if you know where I'm coming from.
Yeah, definitely. And it's interesting because we started this project before COVID-19, and I'm sure a lot of the points that have been raised are as a result of COVID-19, because we can't, you know, think about our thoughts and opinions on these topics without taking into consideration the change that we've been living through.
Young people felt protests and anger were bringing people together more than positive experiences, and we can use coronavirus as what's that word? As an example. There is a concern among young people that communities will only come together for the COVID crisis, but this will not be sustained.
So a quote on the screen is, "We seem to be suffering from a lack of information, a lack of training and empathy on the front line. This is the inverse of what we need if we're trying to motivate people to move on with their lives." And I think this is really important because one of the things that struck me most about the research we've done on welfare and benefits is, despite the absolute meagre sum of money that people, especially young people, are getting off the state, one young person actually said, "I don't care about the money. I don't necessarily want more money. I just want it to be treated with respect." And I think it comes down to that universal need to feel valued.
There are a striking number of mental health illnesses facing young people. This was something that came up quite a lot, time and time again. And people felt that CAMHS treatment didn't always take a particularly tailored approach. So one interview stated that she was given CBT before and it didn't work for her, but when she went back for more help, they gave her CBT again. So it was almost like they weren't listening to her needs and wants. So whilst it should be no decision about me without me, people were making decisions that she didn't necessarily agree with for her own health. And people felt that community organisations provided a much more tailored approach.
Based on these findings and so much more, the young leaders have been hard at work developing a vision. Here are just a few highlights from the young leaders discussing what the world should look like in the year 2030.
Housing is now much more affordable in all areas of the country. This is due to a new wealth tax, which has made it financially unattractive to have a second, third or even fourth home as a point of speculation and therefore to stand empty. This tax has been hypothecated, which means the money the government earns on it can be spent on buying these houses that will be inevitably resold on the market once it's unaffordable to use for speculation. This means that council houses are being popping up in all areas of the country, so that your postcode no longer is a marker of how much wealth you have, and there's increased levels of mixing and social cohesion of people from all socio-economic backgrounds.
Imagine the year 2030 and a housing structure that emphasises individualism, trust, safety and confidence for the people living there, and a place that you can call home. This structure is a multi-purpose, dense social housing site, including but not limited to recreation and sports facilities, a local GP surgery with localised home community care visits, which stipulate to health home checks as part of the local health and care service, a school ranging from nursery years to further education, and a park that is public ownership, all of which are no longer privately owned, as was the case 10 years ago.
In 2020, Charlie would have only been taught by teachers. Now, in 2030, Charlie has the opportunity to be taught by his older peers, such as Year 10 students. This allows students to develop their leadership skills and facilitation skills, and so that they can gain more life skills during school at a younger age.
So in 2020, the education system was less nurturing, which meant Charlie's mental health could have been at risk in school. In 2030, schools now focus on the mental health side of bad behaviour, which means Charlie can get the support he may need.
Experts by experience and experts in the community of any age from different fields come into the school and provide learning from the outside world, so that it's less academically based for anyone who wishes to attend. And this also includes other members of the community, so anyone who wants to come and watch these lectures kind of thing can. The school is a resource for the whole community, so things like science labs can be accessed by people who are trained to use on weekends and stuff like that. And diversity training is provided for all members of staff within the school.
Community health hubs have given young people the opportunity to volunteer and so strengthen their CV if they haven't necessarily got the right qualifications for school.
Youth groups which also have people you can go to and talk to someone you trust. Cooking classes, how you handle money, etc. The young people should be running their own youth space. They get to decide what happens there and make their decisions which will affect them.
The community shapes where this goes. So when you give people space to grow, it's run by the community. It can go in all sorts of directions, and also it's tailored to each individual community. And that's about the community actually being in charge of what happens in our community. And there's something beautiful about communities shaping how their areas look.
It was just like the intergenerational connection. So I guess we talked quite a lot about the importance of young people being able to engage with older people in the community and all social groups.
By providing everyone with a basic level of income, adjusting our wealth and income taxes to allow for redistribution, and introducing new economic instruments, we can provide every household with the resources not only to survive, but also to thrive. The state should make it easier to be happy, not harder, and should ensure that your birth does not dictate your future. What is more is we currently possess, even in our COVID and post-COVID world, the wealth and economic tools to make this change a reality.
Number 2 would be to manage the political environment. So different groups in the political environment will have different goals for the NHS. To manage this, all groups, healthcare professionals, patients, families and community members should all have an active role in decision making, both at local and national levels, allowing any policies to be the most effective outcome for everyone.
In 2030, children allowed the space to speak openly with support from multidisciplinary teams, so a play therapist, occupational therapists, counsellors and physical therapists. They enable them the space to mourn and grieve, and as well as to heal and ask for what they need. All parts of the hospitals, so including adult wards and waiting areas, are child friendly to make them open environments for children who are visiting their parents, and to make it a less stressful and scary environment.
That with each Power Ranger they could represent different sort of services that the young person who are looking at with the SEND needs would kind of come into contact with, and the ways in which these services are kind of working together, amalgamating in order to support them, and at the same time how they work together as one whole.
Those were just some of the practical ideas that our young leaders came up with. As much as practical was important, the shared principles and values are what underpin these visions. These started off by asking the participants what their one wish for the next generation of young people were, which then led to developing the golden rules.
My wish for the next generation is a world full of love, respect, talent, of diversity, and a world that blesses me without borders.
One wish for the next generation of young people is for young people to be listened to.
I wish for peace and freedom. And I felt there's just so much more to that. It's so short, but there's so many things that could link into that we need in the next generation.
I think if I had to define it into one word, it would probably be holistic.
That even if we aren't given a good hand like a lot of people are, they should still have those same opportunities and abilities to be able to get places that the people with the good hand are able to get to.
The two are inclusion, include everyone, and prevention is better than cure.
If we don't seek to work in cooperation, we can't achieve the whole thing alone.
We will soon have a vision from the young leaders of the ChildFair State, and this is only the start of the conversation that they would love to involve you in. We really welcome you to get in touch.